Addiction is a complex and often misunderstood condition. It affects millions of people around the world, regardless of age, background, or social status. It's characterized by a compulsive engagement in rewarding stimuli, despite adverse consequences. The grip of addiction can be incredibly powerful, often leading individuals down a path of negative consequences. It's a complex interplay of biological, psychological, and social factors. It's essential to remember that addiction is a treatable condition, and recovery is possible with the right support and resources. To truly understand addiction, we need to delve into the inner workings of the brain. Our brains are wired to seek pleasure and reward. When we engage in activities we enjoy, our brain releases dopamine, a neurotransmitter associated with pleasure and reward. This dopamine rush reinforces the behavior, making us want to repeat it. Addictive substances and behaviors hijack this reward system. They flood the brain with dopamine, creating a surge of intense pleasure. Over time, the brain becomes accustomed to this excessive dopamine release, and normal activities no longer produce the same level of reward. This leads to tolerance, where individuals need more of the substance or behavior to achieve the desired effect. As addiction takes hold, the brain undergoes structural and functional changes. The prefrontal cortex, responsible for decision-making, impulse control, and judgment, becomes impaired. This impairment makes it difficult for individuals to control their cravings and make rational decisions. The amygdala, the brain's fear center, becomes more sensitive, leading to increased anxiety and stress when the addictive substance or behavior is not available. Understanding these neurobiological changes is crucial for developing effective treatments for addiction. Medications can help restore the balance of neurotransmitters in the brain, while therapy can address the psychological aspects of addiction and provide individuals with coping mechanisms to manage cravings and triggers. Addiction is a complex interplay of genetic, environmental, and social factors. While there is no single addiction gene, genetics can influence a person's susceptibility to addiction. Research has shown that individuals with a family history of addiction may be more vulnerable to developing an addiction themselves. This genetic predisposition may influence how the brain responds to addictive substances or behaviors. Environmental factors also play a significant role in addiction. Exposure to trauma, abuse, or chronic stress can increase the risk of addiction. Early childhood experiences, such as witnessing substance abuse or experiencing neglect, can have long-lasting effects on brain development and increase vulnerability to addiction later in life. Social factors, such as peer pressure, social isolation, and cultural norms, also contribute to addiction. Individuals who are surrounded by peers who engage in substance use or other addictive behaviors are more likely to experiment themselves. Social isolation and loneliness can also increase the risk of addiction, as individuals may turn to addictive substances or behaviors as a way to cope with their feelings. Cultural norms and societal attitudes towards substance use and other addictive behaviors can also influence the likelihood of addiction. Understanding the interplay of these factors is crucial for developing effective prevention and treatment strategies. Addressing the root causes of addiction, such as trauma, stress, and social isolation, is essential for promoting long-term recovery. When we think of addiction, we often think of substance abuse like drug or alcohol addiction. However, addiction is not limited to substances. Behavioral addictions, also known as process addictions, involve compulsive engagement in certain behaviors despite negative consequences. These behaviors activate the brain's reward system in a similar way to substances, leading to cravings, tolerance, and withdrawal symptoms. Gambling addiction is a common type of behavioral addiction. It involves an uncontrollable urge to gamble, often leading to financial problems, relationship issues, and emotional distress. Individuals with gambling addiction may experience withdrawal symptoms such as restlessness, irritability, and anxiety when they try to stop gambling. Another prevalent behavioral addiction is internet and technology addiction. This type of addiction involves excessive use of the internet, social media, video games, or other technologies, leading to significant impairment in daily life. Individuals with internet and technology addiction may neglect their responsibilities, withdraw from social interactions, and experience physical symptoms such as eye strain, headaches, and sleep disturbances. Other behavioral addictions include sex addiction, shopping addiction, and food addiction. These addictions involve compulsive engagement in sexual activities, shopping, or eating, often to cope with negative emotions or fill a void in their lives. Recognizing and addressing behavioral addictions is just as crucial as addressing substance-based addictions. The consequences of untreated behavioral addictions can be just as severe, affecting relationships, careers, and overall well-being.